Hey guys, welcome back to Friday's Q&A. Since my last video on tips for pores, I've been getting a ton of fantastic questions about pores. So for today's Q&A, I thought I would focus exclusively on all of your great questions about what causes pores, why your pores are so noticeable, and how to get rid of them. And if you're new here, welcome. My name is Andrea. I'm a dermatologist. I post day in the life of a dermatologist vlogs, as well as sit-down videos addressing frequently asked skincare related questions. So if you're bothered by your pores, stick around and check this video out. Facial pores are visible topographic openings of the skin which correspond to a small hair and its associated oil gland. They're actually a vital skin structure. And the associated oil gland, the sebaceous gland, produces oil that contains important things like squalene, ceramides, waxes that hydrate the skin and allow it to function properly. So the first thing everybody wants to know is, well, why are my pores so noticeable? Three factors contribute to the noticeability of pores: oil production, the sheer volume of the pore, and the size of the hair occupying the pore. The average adult makes oil at a rate of approximately 1 milligram per 10 centimeters squared every 3 hours. However, this rate varies considerably, and factors such as your age, changes in hormones, systemic medications, and your genetics can all influence the rate of oil production and potentially contribute to the noticeability of your pores. With regards to volume, there are a few components that contribute to the volume of the pore. One is the volume of the skin around the pore. Two is the volume of the little baby hair occupying the pore. And three is the volume of oil being produced and put out. Everyday changes in hormones can influence volume of pores, and by insulin levels. Age-related loss in elastic tissue surrounding the pore follicle can also make it more prominent by virtue of dilation. Furthermore, a lifetime of sun exposure or smoking further annihilates this underlying dermal framework, contributing to the noticeability of pores. Acne and other inflammatory skin diseases can cause micro scars in the supportive framework as well, further contributing to the noticeability of pore size. And lastly, excessive use of harsh scrubs, peels, even certain acne medications can transiently make the appearance of pores more noticeable by virtue of removing the very, very top layers of the skin that previously were masking the pore opening. So the next thing everybody wants to know is, well, that's fantastic. How do I get rid of my pores? Well, as I mentioned, pores are a vital skin structure and you actually don't want to get rid of them. They're critical for the health of your skin barrier. Open any magazine and you'll see a large number of supposed interventions that claim to minimize pores. So which ones really work? The key thing that you need to know is that there are no solid evidence-based studies to support the use of any intervention to minimize pores. However, because pores are such a pervasive cosmetic concern, there have been some efforts in some very small studies to begin to determine effective treatments. And because there are different contributing factors to pore noticeability, it's important that interventions are individualized. So given that pore noticeability is driven largely by oil production, it doesn't surprise me that many of you ask me questions: how do I decrease my pores and get rid of oiliness and shininess? Well, there are medications that can decrease oil production. These include isotretinoin or Accutane, oral birth control pills, and a pill called spironolactone. However, these are not appropriate for everyone, so be sure to talk with your healthcare provider to learn more about these interventions and if they may or may not be effective or right for you. There are also a few medications applied to the face and topical creams that can also be potentially helpful in decreasing oiliness. First line would be a vitamin A derivative. These are prescription retinoids. These offer potential to improve the look of pores by virtue of the fact that they function in reversing collagen and elastin destruction from cumulative sun exposure and age-related changes, as well as old acne scarring. Retinoids that have been tested and have been shown to be effective are tretinoin, brand name Retin-A, and tazarotene, brand name Tazarac. Retinols and non-prescription cosmeceuticals like The Ordinary, La Roche have not undergone any rigorous testing and investigation in an unbiased manner to demonstrate efficacy in this arena. However, it does make sense that they could potentially offer some help in mitigating the size of your pores. Additionally, the over-the-counter FDA-approved medication for acne, adapalene, brand name Differin, is a retinoid. However, it has not been studied in mitigating pore size. It's important to note that a big part of how retinoids work in the skin is by unplugging the pores and lightly peeling the very top layer of the skin. And in doing so, pores can subsequently become a little bit more noticeable. And as you're flipping through the magazine, you can't help but notice that the celebrities are all going dairy-free and singing its praises. So I get a lot of questions. Are there any diets that I should be following to make my skin better and to improve the look of my pores? Should I go dairy-free? Should I go sugar-free? Well, we know that diets rich in sugary processed carbohydrates that have a high glycemic index raise insulin levels. And as I mentioned in the beginning of this video, high insulin levels can drive oil production. Additionally, cow's milk and fat-free dairy products also have potent effects on insulin levels. Also, an association has been observed between severe acne sufferers and consumption of skim dairy products. While further studies are needed to better clarify the role of diet on oil production in the skin, it's not surprising that many individuals anecdotally report an improvement in the appearance of their skin, their pores, and their acne by virtue of following a reduced sugar diet or eliminating dairy in their diet. I also get many questions about, can I recommend a mask to get rid of pores? No. I will say this, the ingredient bentonite and bentonite clay masks can absorb sebum or oil in the skin and transiently make the pore size appear less noticeable. However, I will emphasize that any improvement you see is transient, and if anything, many of these masks can contain ingredients such as botanical derivatives and fragrances, etc., that actually have the potential to be irritating to your skin, further worsening the appearance of your pores. So I don't think they're necessary, but it doesn't surprise me that sometimes people report that using a bentonite clay mask improves the look of their pores. The next question that I get a lot is about chemical peels and improving pores, and is there a chemical peel that would help pore size? So various chemical peels used in skin rejuvenation and cosmetic dermatology have actually been shown to improve the look of enlarged pores transiently. These are performed in an office setting by an experienced healthcare professional. They act to temporarily break apart plugged up skin cells and allow regeneration of new healthy skin cells, thus improving the look of skin texture, brightness, and pore size. Such peels include glycolic acid as well as salicylic acid. However, like the masks, the same holds true in that most effects are not long-term or sustained. What about all of these creams and serums that are sold over the counter that claim to get rid of pores? Do you recommend any? The cream that I recommend to everyone is a sunscreen, a broad spectrum sunscreen containing zinc or titanium dioxide. The reason I emphasize sun protection so much is that the sun drives inflammation into the skin, damaging the supportive framework around the pore, further contributing to the noticeability of pores. Now, I mentioned a salicylic acid face peel, but also salicylic acid based washes sold in over-the-counter acne medications such as Neutrogena oil-free 2% salicylic acid face wash also offer the potential to improve the look of your pores. Now, given that everyone is so concerned about their pores, it's not surprising that the cosmetic industry has a huge motivating drive to identify new ingredients that can improve facial oiliness and the noticeability of pores. More in-depth studies, however, are needed to say for sure if any of these ingredients are worthwhile. Some ingredients that have a little bit of preliminary evidence for potentially being helpful in minimizing pores include orthocyphins stamineus or Java tea as an ingredient in serums and creams applied to the face. Additionally, topical L-carnitine, 2% niacinamide, derivatives of chlorophyll, a plant green pigment, and jasmonic acid, a plant hormone derived from linoleic acid. Now, cosmetic companies are all over these ingredients, and they can be found in many expensive high-end skincare products, claiming to rejuvenate the skin and improve the appearance of pores. Please remember that more research is needed to say for sure if any of these are a worthwhile endeavor. I also get a lot of questions about, do any of the in-office procedures like lasers, photodynamic therapy, microneedling, are any of those good for pores? Devices that deliver targeted heat or ultrasound energy to the skin, as well as those that create tiny little puncture wounds in the skin by virtue of microneedling, do have the potential to improve the look of pores. The mechanism of action of these light and procedural-based interventions is postulated to be a combination of remodeling of the supportive framework around the follicle, decreasing oil production, as well as photo destruction of the tiny hair occupying the pore and contributing to the noticeability of the pore. The literature on the use of these devices, specifically for mitigating the size of pores, is too limited to say for sure if any of these would be a worthwhile endeavor. If you elect to pursue one of these interventions, I would encourage you to definitely do your research. Make sure that the individual performing the procedure is licensed and has expertise in operating the device and the science behind these devices. I've mentioned this in prior Q&As before, but I'm not a fan of exfoliating brushes or at-home microneedling devices. The sonic facial brushes are very aggressive and irritate the skin. And when the skin becomes irritated, it loses water very quickly, it becomes inflamed, and the pore is left saggy and very, very prominent. I'm also not a fan of the at-home derma roller because this attempts to recapitulate microneedling, which creates a tiny wound in the skin. This should be done with a sterile instrument, and you can't guarantee the sterility of your at-home derma roller. And in creating a wound in the skin, you open the potential for a significant skin infection, which could be very dangerous to your health and potentially quite disfiguring to your skin. So hopefully that's just about everything you guys have ever asked me about all of the claims for getting rid of pores. I really hope it was helpful to you. I want to leave you with this. In skincare, I believe that simplicity is key. The more things you try and put on your face and the more things you try and do to your face, it's going to retaliate. And in doing so, your pores will likely become more noticeable as the skin suffers. Don't neglect sun protection and don't neglect moisturizers. In the description box of this video, I have listed below some non-pore clogging sunscreens and non-pore clogging moisturizers. When the skin becomes dry or damaged by the sun, it becomes inflamed, irritated, and pores subsequently become more noticeable, and oil production gets ramped up in an effort to heal the inflamed and irritated skin. I want to thank you guys for all of your fantastic questions in this arena, and I really hope that this video was helpful. If you liked it, I encourage you to give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys in my next Q&A.